So I'm here today to share with you kind of a macro view of the trends that we're seeing in the industry and employee benefits today. We run an annual survey of about 1,700 different employers, and we also have conversations with over 100 brokers and employers and plan leaders across the country each year, where we try to distill what are the major things that are happening in the market, where are we seeing the most change, and how do we look ahead? The theme has been clearly innovation, and I think now more than ever, the industry is very ripe for it, just given all the pressures that we see today. As I mentioned, we have an employer survey that surveys about 1,700 employees, and I'll be curious kind of throughout. Feel free to ask questions throughout. We don't have to wait for the end. It's always great to have a two-way kind of conversation because I can learn equally as much from all of you. Some of the themes that came out of our survey this year was, one, cost of care, rate increases. I think it was a testament to the group earlier of keeping rate increases flat. Nationally, we're seeing rate increases of 10, 20% in some markets for a small group. Innovation. Over the past several years, when we've looked at the membership growth of the largest carriers, so mostly the BUCAs and some other regionals, over a quarter of their new member lives have come from new products that they've launched in the past few years. Those things include some of the benefit platforms that they also using their own TPAs. Some of it has been things like the dynamic copay plans that have started to launch in the market. Some of it has been also things like level funded that help transition those employers from fully insured to self-funded. And so I'd say it's really top of mind for the administrators and plan coordinators of how do we continue to serve employers, because we realize that there's a lot of cracks in the system today. And third is experience. We have seen with the cost pressures today that experience has started to kind of take a back seat, but employers are not willing to give that up. And I'm sure that's true for many of you in the room. Experience is still very, very much top of mind. We're no longer in the world, I feel like, of that HSA, HRA world like 10, 15 years ago, where folks were willing to cost shift, initially for cost reductions rather than experience. Now we're seeing employers say, we do need to manage our costs, but we're not going to do it at the expense of deteriorating our experience for our employees. And then lastly is technology. It's hard to get through any of these presentations without mentioning AI. But we are starting to see a lot of introduction of AI, mostly starting in the back end operations where it's less visible to the employer. But over the next few years, and it's already starting to happen, it's going to happen pretty quick, we're going to start to see a lot of those tools and solutions become much more employer and member facing. So these are the four major themes that I'll kind of walk through today. And like I said, feel free to ask questions along the way, and thank you for having me share some of these insights. We look nationally across the country around what are the rate pressures that are happening today. And compared to 3-4 years ago, won't be news to everyone, we're all feeling it. Before rate increases most of this map was really actually in that light blue. Most of the rate increases were less than 10% a few years ago. And now you can see there's a lot of dark, and probably next year might even get darker. Over 20% of our small, mid-sized businesses that we surveyed are expecting rate increases of 10 to 20%. And at the same time, they're saying that their benefit budgets are not increasing. So there's a clear gap there. Cost of benefits going up 10, 20%. But employers are not able to budget or expand their benefit budget. And so I think this is a ripe situation for things like the innovative solutions that were just discussed earlier. At the same time, like I mentioned, employers are not able to increase their budgets. You can see that about half the group is slightly increasing their budget for benefits, but the other half is either staying flat or actually seeing benefit decreases, given just broader economic pressures to their employer business. And as we see that, employers are actively making decisions as to what products are they focusing on. And something interesting that we've heard over and over from employers has been they're not as interested in cutting those benefits. They don't want to make those deductibles higher for their employees. They don't want to cost shift. So they're trying to find ways with different vendor partners, different care management partners, different pharmacy solutions to really try to take the cost out before it hits the member or the employee. A broader theme we're seeing is we also archetype a lot of employers. Employers make different decisions based off their industry, their maturity, the sophistication they have in their benefits, the type of population that they're serving. And we often group them into call it talent seekers. These are also employers that are really differentiated based off of the quality of talent. You think a lot of like technology firms that might fall into this bucket. Long-term total cost of care. So you can think of some employers that are really having to manage the long-term cost. A lot of employers with kind of aging workforces, with kind of pension plans in place, things like that often fall into this category. There's some employers that are really seeking stability. So really don't want necessarily to do the innovation. Their goal is actually to keep things predictable for their employees. They want to keep things very stable, especially in times of change. And then lastly is the near-term low cost. These are employers that really, the benefits are there kind of not as a forefront in attracting talent. They're there to be kind of market competitive, but no more. And you see those employers really trying to take the most economic action. And there's pros and cons of each, and each are dependent on what the employer's strategy is for their talent, what their culture is like, the level of sophistication they have, their size. So there's no wrong or right, kind of like archetype, but just different decisions will be made by employers based off where they are. And what's interesting is that we are seeing kind of some trends change in terms of where employers are self-identifying. Kind of during that COVID boom, if you will, probably the wrong way to say it, but the economic boom that followed that period, you saw a lot of that talent attraction market. You saw a lot of employers saying we are seeking the best talent. It was a tight labor market, and they were really trying to put out the best benefits possible. Now we're starting to see a bit of like a reversion from that, and really employers are starting to emphasize a bit more of the cost control as well as minimizing disruption. And I think this has echoed a lot of the conversations I've heard and seen as well, where employees are saying right now things are changing a lot for our employees at home, in the world. We really want to make sure that we're able to offer something they understand, is predictable, but we also need to make sure that we're managing the costs for the longer term and not just for today and tomorrow. Maybe I'll pause there actually and hear from you guys, like, does this kind of decision-making archetypes resonate with you? Do you feel like there's kind of other factors that are top of mind as you think about your own benefit trajectories going forward?
I know stability became very important post-COVID because you had everyone's costs go up, but no one's wages were really catching up with that. So it's like you couldn't come back every year and go, oh, you got a 4% raise, health insurance went up 6, vision went up 1, life went up 2. Good luck. So I go, that was really important, and like switching from a professional services category to our pseudo-governmental space, like that still seems to be very much the same thing there, where raises in that space are very much are 2 to 4%. Health insurance can very easily exceed that every year. So I go, that's very important.
Yeah, thank you for sharing that. Any others?
Stability comes across from a different perspective, which is the disruption, right? Most of the time when they're using PEOs, they're not even considering self-funded, so the cost savings most of the time is not even the equation. It's really about not disrupting anything at all. Not sure, is that what you're saying as well?
And like network disruption? Yeah. I mean, I think that falls into, it's similar, like the goal of these employers that in our survey was really around how do we just keep things comfortable in some ways for our employees. There's a lot of other change that might be happening in that organization. or just broadly for their employees. They want to make sure that they're able to see the doctors that they see. There's not significant changes there. To your point, like wage increases, like the kind of the calculus or the proportion remains stable for their employees. So that is really a lot of the driving force for that group there. And as we see, we also ask just employers, like, what are the most important factors as they think about purchasing plans or changing their benefit strategy? And not surprisingly, cost is number one. And I will say, like, when we've asked this question over the past several years, that cost number has been quite stable. So I was actually expecting this year, just given the trend and the rate increases we saw in small group, for that number to just really skyrocket. And it hasn't. It's really been stable for the past 5 years. And so that really showed me was that all the other aspects that we talked about, like the talent attraction, the stability, the desire for innovation, like all of that has like risen instead. Like cost is important, but folks really want to continue to emphasize experience and predictability and things like that for their employees. And then when they think about non-cost factors, really like health management programs. I think earlier they mentioned bringing in like a diabetic care management vendor, as well as like employee customer service. Those are kind of the top two that have risen. So again, experience and finding ways to kind of help support the employee through their health conditions has been first and foremost continuing to be the most important things. And of course, we also ask them, what are their challenges? And not surprisingly, medical inflation is number one. So here you can see that across everything is going to be that cost calculus I shared earlier of inflation versus employer budget. How do they manage that gap? And what do they do going forward? And I think it's really interesting that the story shared earlier was around that fully insured to self-funded transition, or at least helping address that area of the market where a lot of employers are maybe considering making the switch but haven't done so yet. And I think that is also largely a national trend that I'll go back, but a trend that we see largely. So here we looked at nationwide. What is the rate of fully insured membership state by state? And you can see how red the country, like how red it is overall. There's of course some states, largely some of the less populated ones, that are seeing some growth in fully insured markets. But for the large part, there's significant decline. And Aetna recently announced that they're leaving the small group market in some states. And so you're starting to see exits from the BUCAs and from the carriers, because for them, even them, the market's getting too volatile to be able to manage and handle that risk. And so you can imagine for the employers, right, like that volatility is magnified, because now, you are that unit that's managing it. And we're seeing increasingly more employers exit that fully insured market to go self-funded. And there's been things in the market, right, that now help support employers making that transition, that I think this is a result of two things. One, the increased volatility in the market that we're seeing today, and that's expected to last or persist for the next several years. And the second is because now there are tools. There are tools in the market that may not be well known, but that do exist and have supported a number of employers in making that transition. So you have a lot of TPA carriers, and some of those TPA carriers are owned by the BUCAs. You also have a lot of reference-based vendors out there. You've got the captive market increasing to help support small group employers access stop loss. And I think those types of solutions are only going to increase, given that the market for this type of employer is significantly increasing. I'll go back now, and I wanted to share just some of the ideas that employers had shared that they were considering implementing. And a lot of these have been things that have been done before. And we kind of organized those ideas that employers had shared with us into kind of three different levels. The most cost impactful at the top. These are the most disruptive, generally speaking, to get those cost savings. The kind of middle tier, which is a lot of product design changes, usually still supported by a consistent network, but the plan design itself on top of it is changing significantly. And then everything kind of in that bottom layer is a lot of programs, wraparound services that often don't directly touch the plan design itself, but is kind of in the back. So a lot of employees may not be aware of it, but help kind of drive savings. And these are a lot of the things that employers had shared that they were considering or have done. And now I think really the question is like, what comes next? What comes on top of this pyramid? And what we are seeing is a lot of employers talk about, in the small group space, using captives to access more affordable stop loss. Direct contracting was mentioned for some employers. It's not right for everyone, but for some. We're also hearing a lot more now. I mentioned AI, and I'll get into that a little bit later, but from TPAs and health plans, being able to use AI right now on the back end of operations to help get those admin costs down and be more competitive. But we're also starting to see pilots and early proof of concepts around how to have a concierge AI, right? Like an AI concierge coach for members to guide them through, direct them through. And those are kind of tools that are not widespread yet. They're not launched yet, but I imagine will start to come out into the market, in a few years to help be that handheld guide for employees as they move on. And so what I think will be interesting is in a few years, how does this list augment or change with technology and with the macroeconomic pressure that we see here? Maybe I'll pause too and see which ones you guys have thought about implementing or experimenting with and results that you've seen.
What is your take on value-based care, and especially for employers? How should we look at it? We've been talking about for more than 5 years. It's still unclear, what it is.
A lot of value-based care success happened in the Medicare market to start for a lot of reasons. I think in the Medicare market, what made value-based care largely successful, especially in primary care models, was one, the provider and the doctor and physician had more control over the economics with things like risk coding and quality scores that contributed to the financials. Providers had more direct control over the economics. Two, when you think about the spend for a Medicare member, it's, multiples of what it would be for an average employee. And so the condition set is much more complex. So there is, in some ways, a lot more efficiency or more savings to be had with a very focused model. There's also just more homogeny in that group from a medical perspective. And so it's a bit simpler, I would say. Not easy, but simpler to kind of design a care plan or a care model that helps deliver care for that population. In the employer market, you're often having employees that are maybe young, without families yet, very healthy, as well as, individuals that have more complex conditions. You're also dealing with maternity care, right? So the condition set in the employer market is much, much more vast, which makes it a little bit more challenging for value-based care to address. Where I do see value-based care being successful is usually often in more condition-specific programs. So episodes have generally shown efficacy. You could argue a lot of episodes is a different form of contracting. I would also say when you think about things like there's now maternity care programs, right, that do value-based care just on that pregnancy event. You see it in cardiology, you see it in musculoskeletal, you see it a lot more success in areas that kind of have defined medical events. The question is how does that success now grow into the chronic management, right, over years and decades? And I have spoken with a couple of firms that are very interested that might have started in a condition, but feel like their model is successful enough that they could expand it from cardiology to diabetic. And so we are seeing a rise of cardiometabolic value-based care companies that are trying to grow their models. And so I'd be excited. I think there's a lot of optimism. So I'd be excited to see how those continue. I will see, I think, a constraint in the industry that makes it difficult in the employer market is just churn. Employers and employees move. They move employers, they move health plans. And so something that's just really inherently difficult about value-based care in this population space is the fact that that long-term benefit can sometimes be hard to see because the person that you're investing in today may or may not be there, 5, 10 years from now. Doesn't mean it's not the right thing to do, but just being aware of that and being aware of like how to measure then your program and your endeavors accordingly. I saw some nodding over there with value-based care, so I was curious as to any programs you've experimented with or what your experience is in that arena.
So we built a value-based care platform for MSK. Thanks. Yeah, we built a value-based care platform for MSK, leading with AI, triage diagnostics, et cetera, for ortho and PT. And we built it to where we're moving it around movement health, not just MSK, because it can be very myopic. But really, if we're not moving, all other conditions are getting worse. So we're integrating those things in. I've been a care provider in the past. We're now integrating the tech and the care. So I agree with you entirely because of churn, but we're looking at, when you think about an episode, we're narrowing it down ironically to episode. It goes beyond that, but looking at that technology, because VBC is designed to where, how are you managing the care, how are you managing payments, et cetera. So it's perfect for an employer to do it in that setting. But I agree, the 10 to 20 year span is very different than the original Medicare approach. So I was just nodding because it's great to hear the two of those converge. I would love to hear your thoughts of how that has been successful in an employer environment.
Yeah, so the ways that I've seen it, and so I would say, like, first, I have not seen it, like, widespread. Like, we're definitely not at scale yet in the employer market. I think there's potential, but we're going to have to overcome some of the hurdles, like the long term. I think the churn and how we're measuring value over, multiple years. I think some of the ways that I have seen some carriers do it, I'm talking about now at the health plan level, is often, even if the member changes employees, they're still with the same carrier. And so I've seen them try to link those care costs so that way they can manage and look at care costs over that 5-10 year period, even if the employer changes. Often I see just multiple models. I think Mark was talking about stacking direct contracting with reference-based pricing, with then single case agreements. I think with value-based care, it can get tricky with the calculus, but I often see stacking. So you might have primary care models. You might also have SEP episodes, and for things like MSK or different surgeries. And then you might also have kind of more of your chronic management. And now you do have to be careful about the overlap and how different vendors or different programs are calculating value and who's getting their share of what. So usually I see that done in like a hierarchy method, right? Where like the most, like the smallest unit gets the highest hierarchy, generally speaking. But I think the way that I've seen employers get more meaningful savings across the entire population is approaching it through several different models. Yes.
I think there's so many acronyms and vernaculars around things. So we're purposely not terming it VBC to employers because, to Alberto's question, that really resonates more on the care provider side and with contracting with payers. What would you term it as? Because we only have short periods of time to speak with people, and we need to effectively communicate. There's so many, like I said, acronyms and language. How would you term it when we look at this? Because it's kind of holistic care, but I think we're creating new terms. I'd love to hear your thought on that.
So I guess I've been working in like healthcare for 15 years, and I have not seen the number of acronyms or anything decrease over time. Things only increase. So I would say I think maybe take your shot at a couple of different words because there's so many out there that I do agree. Value-based care tends to resonate more with like physicians and hospital systems and those delivering the care because they know of a fee-for-service model and they know of a value-based care model. Now for employers, I would say like, shouldn't everything I get be value-based care? Like every dollar I pay for, I want to get value out of it. So that statement resonates with me from an employer's perspective. Holistic, I've heard that word used a lot right now. So I've also heard like whole health, kind of like whole health being used. So there is a trend right now, I feel like, around like the whole person, holistic. So you're probably not far off the mark, but yeah. Yes.
So you mentioned artificial intelligence from a concierge for employees basis. Where is that at,
Yes.
in your opinion?
Yes, I'll kind of skip ahead. So, let me go back. So we work with a lot of organizations on AI and their AI missions. This is kind of like a very brief synthesis of like the different components that a health plan has to go through between claims payments, engaging with members, customer service, right, creating a network. And there's so many different roles that we're seeing AI play a use in. Like I'll give you one quick example and then I'll get to your question directly, which is first, like I shadowed a customer service operations for a health plan. And it was eye-opening for me because the customer service agent had to pull up 4 different systems to handle one call. They had to access the benefit system to understand the members' benefits. They had a different system to look at the provider network and like which providers were closest to that member. They had a different system for claims to understand what claims that member had incurred and what the claim issues were. And then they had another system for like the call log of like how many times did this member call in, what was their past. So in the past, that's been a very expensive endeavor for like a health plan to fix because of the fixed cost nature, right, of tech improvements for a system that large. But with AI, they're seeing, the cost, the marginal cost for handling those things, being able to integrate unstructured data now is becoming more feasible, going forward. And so what you're starting to see is health plans and like the benefit platforms are really starting on the back end, where there's less risk to the market, if you will. So that's where we're seeing a lot more investment, a lot more appetite to experiment with AI use cases right now is in the back end, where it's like honestly less visible to the market and the member and the employee as they kind of like trial it and figure it out and get their organizations accustomed with building it in. Going forward, and maybe I'll just pause here, which is when we look at the cost impact or like what we think AI could deliver, we're thinking meaningful numbers in terms of admin, med costs too, where you're able to direct some of the care navigation, and then also through just revenue, mostly on the government markets and less so on the employer side. This is like an example mock-up, but what we are starting to see is that we're talking to health plans that are starting to conceptualize it and do soft pilots with like AI, at least AI customer service. Again, they want to start off with like lower risk ways to bring it into the market. So you'll see, like I think Cigna had announced earlier, I think United's working on something similar, like these are all public, kind of AI assistance. And then over time, I'd expect like a lot of health plans, a lot of the benefit platforms will start to integrate that with a lot of the care management solutions, with care navigation, with advocacy solutions that are out there. So that way becomes truly like the one-stop shop. But it'll take time. It'll start off with pilots. It'll, expand. And there's a lot to navigate from like a risk perspective for these organizations before they get there. Well, I know I paused on at least like the aspirational kind of direction that AI might bring to the industry, but wanted to pause and see if there's any other questions, as I think I will be passing you off to someone else soon. Yes?
Can you go back? I think it was slide 7 or 8 or 9 or something. It was a survey. Sorry, go back. Okay, the one before this, maybe?
This one?
Before this? This one.
Yeah.
So at the very bottom,
Yes.
ability to provide a more holistic health package looks
Yes.
like the number 2 most thing that employers are interested in, physical and mental
yes.
health.
Mm-hmm. Yep.
Can you just talk a little bit more about what that means, if you have any insight or depth other than that, like underneath that one sentence? I thought it was just interesting looking at all of these different things, that was the number 2 that they were interested in.
Yes. It's a good question because we also have gone through this without even mentioning mental health or behavioral health and those things, where there's a huge spike. There's a huge spike, I think, one, because of like just the underlying conditions that are affecting society right now, and then 2, just like the values that are coming out in the new generations in terms of integrating mental health, behavioral health with physical health. And so really like what that is addressing is a lot of times in health plans, we've got the medical plan, And then you have like mental health or behavioral health vendors and providers. And for a lot of people, that's feeling really disjointed in their experience because they're working with their traditional health plan and medical benefits for one. Then they have to go to a different like wraparound solution or a different digital vendor for their mental health services. And for a lot of, we also kind of look at responses based off generation cohorts. And what we're seeing for like the newer generations, Gen Z and et cetera, is that they view it as holistic. You know, I think the industry has evolved where behavioral health and mental health was getting added to a traditional medical industry, which is why it's so fragmented and disjointed. But like the values of like the generation and society are shifting to like, I'm one body, like I am one person, it is all one thing. And we know from studies that medical costs are highly, highly correlated with like mental health costs, mental health issues. And so they are truly one, but from an experience perspective, people look at their health plan, they look at the vendor logos, and they're like, this is not connecting. As dental? Like dental vision? That's interesting because I have not heard as much there. I think, I'll be honest, I think largely it's because of the economics related to it. And I am someone who's like obsessed with my teeth. I love going to the dentist. So like I am someone who like, yeah. So I am someone that I would be like, I think dental care is like more important to me right now than like medical care. But like, so I definitely see like a world in it. I haven't seen the fundamental economics like support the case for it as well as it does for mental and behavioral health. Yeah. Okay. All right. Well, thank you so much for having me today. I really appreciate it, and hope you look forward to the rest of your day.